Tonight's topic revolves around the COVID-19 pandemic and a once kind of ubiquitous phrase that we actually haven't heard in a while. And you know what? Let's take a second and refresh your memory.
Herd immunity.
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 Okay, so there's that phrase again, herd immunity. It's back in the conversation because basically experts are telling us that Oregon could reach herd immunity in 2 months.
Yep.
Yeah, so Ashley Korslien talked about this at 4 and 5. We want to go more in depth. So let's just start with reminding people, because it's been a while, what herd immunity even means.
Yeah, so let's just talk specific to start with the Delta variant here, because that's what we're dealing with. That's the dominant strain impacting people here in Oregon. So 85%, Maggie, is the magic number. So essentially, experts say 85% of the population either needs to be vaccinated or develop natural immunity by getting a COVID infection. And so at that point, when we reach that 85%, it's really hard for the virus to keep spreading because there aren't that many people left for it to infect. That's the theory. So I talked with OHSU data scientist, Dr. Peter Graven, and he says Oregon could reach that 85% threshold by December 26th.
December 26th. I mean, so basically Christmas.
Right, exactly.
Okay. So you probably remember at home, we saw how overwhelmed our ICUs have been, including at OHSU. Our team did a special inside that ICU. So does this news about herd immunity coming mean that relief is coming for those hospitals too?
I think that's kind of a tough question to answer with a specific answer.
Okay.
I would tend to say yes and no, and here's why. So obviously, it's good news that overall the cases in Oregon have been dropping since early September or around there. So that's good news. And even though the strain on hospitals will start to ease a bit as we go into the next few weeks and months, Dr. Graven says we have more grim days ahead, many more grim days ahead. He says more than a fifth of people in the state are still vulnerable to infection.
You know, it's still going to mean before we get to this 85% level that we're going to have 177,000 more people get infected in Oregon, 50,000 of which will show up with potentially a positive case result. We know that there's going to be deaths that result from those. You know, I would estimate probably around 700 deaths, in fact. And so, you know, that to me is not really a relief. That's going to be more people that are going to have to go through this.
Okay, so that is really sobering to hear that a lot of people could still have hard times ahead. Yeah. You were telling me earlier, like again, you reported on the herd immunity expectation at 4 and 5, but we wanted to talk about this on this show because you were telling me that in addition, kind of more in depth, experts are saying there could be another wave of challenges headed toward hospitals. So even when these COVID numbers start to drop, more challenges are coming.
Yeah, exactly. So we already know that hospitals are dealing with a pretty catastrophic nurses shortage that's been going on before the pandemic.
Right.
Exacerbated now by nurses leaving the industry. But then you have the vaccine mandates where people have lost their jobs in the healthcare system for refusing the vaccine. On top of all of that, though, this is what I thought was really interesting that Dr. Graven talked to me about was the fact that so many people have put off critical services, critical care, think screenings, doctor's appointments, things like that throughout the pandemic, that he anticipates that our hospitals, while they might be able to come up for air a little bit when it comes to COVID, a surge in the hospitals, they're going to be dealing with all these people who have put off preventative care and might end up in the hospital. So he thinks it could be pretty taxing on the system, on the healthcare system for quite a while. And again, I just want to point out these are his predictions, right? These are projections. So we'll have to just kind of see what happens in the next few weeks and months ahead.
Yeah, you hope it's not as dire as they're saying it could be.
Exactly.
But they're watching and we are too.
Yeah.
Ashley, thank you very much.
Thank you.